The U.S. is working to get ahead of the monkeypox outbreak, now called Mpox, in many parts of the country.
Right now, there are 14,000 confirmed cases in the United States. That's according to the Centers for Disease Control. New York and California have the most cases, with more than 2,500 in total. They're in the red, as you can see. Florida, Texas, and Georgia all have at least 1,000 cases, and then 17 other states have at least 100 cases. Those are in yellow. You can see them right there. It includes Arizona, Colorado, and Michigan, and these final states have less than 100 cases, lit up in green. Wyoming is the only state right now with at least one confirmed case.
It is acting differently than any monkeypox outbreak we've known before. It's clear the epidemiology, it's clear what strategies need to be implemented to be able to control the outbreak. And it's also clear which populations we need to focus on.
Starting Monday, the White House will try to speed up monkeypox vaccinations by meeting people where they are.
The administration is setting aside 50,000 doses for cities with upcoming LGBTQ pride events based on the size of the event. The White House also says nearly 2 million doses will be coming in next week, and another part of this plan will stretch the vaccine supply. Earlier this month, the FDA authorized healthcare providers to give 5 shots from a 1-dose vial. This will allow more people to get the vaccine from a limited supply. Right now, that method is only being used in Los Angeles County. No other county in California is doing that.
Well, today, California officials gave an update on the monkeypox virus, including a name change. KCRA 3 Capitol correspondent Ashley Zavala explains.
California Department of Public Health Director Dr. Tomas Aragon confirmed the state is now avoiding calling the virus monkeypox and will instead refer to it as Mpox or MPX. State health officials didn't give a specific reason for this today, but we do know the World Health Organization has called for changing the name to make it less stigmatizing and discriminatory. Here's what we know about the virus in California. The state has a total of 2,660 cases statewide. More than half of those cases are in San Francisco and Los Angeles. The state so far has recorded 62 hospitalizations with no known deaths. On vaccines, the state has received 109,471 doses and has distributed 66,000 vials across the state. Now that the FDA has approved splitting doses to boost supply, it's unclear when exactly California will begin this practice and what it will mean for the state's supply. We are still waiting for the Department of Public Health to clarify. The state also released its own set of isolation guidelines that are more specific than the CDC's, depending on where lesions are on the body or where an infected person works.
One of the challenges is that the general CDC guidelines basically says to stay home until your lesions have completely healed over with new skin. And part of the problem is that some people have lesions that are very limited on their body. And it may take a while for that to heal, and they may be in a part of the body that there's no risk of exposing other people.
Today, state health officials also confirmed they plan to use the MyTurn site, which was originally set up for COVID-19, for Mpox vaccine appointments. But they say setting that up is still in the works, and it's unclear when exactly that will be up and running. Reporting in Sacramento, Ashley Zavala, KCRA 3 News.